Hello everyone, welcome to another session of Recalls discussion. Let's start with question number 71. Cushing syndrome is a condition associated with the options are hyperthyroidism, excessive accumulation of copper in the body, hypothyroidism, adrenal hyperplasia. So what is this Cushing syndrome? The classic Cushing syndrome, the symptoms include redistribution of body fat, puffy face, hirsutism and increased appetite is observed in excess corticosteroid replacement. So here the correct answer is option D, that is adrenal hyperplasia. Cushing syndrome is a condition characterized by adrenal hyperplasia caused by overproduction of adrenocorticotropic hormone by the pituitary gland. Patients with this disease will often have obesity, hypertension and gonadal dysfunction. Next question. Hemolytic anemia due to erythrocyte deficiency of glucose 6-phosphate dehydrogenase, that is G6PD, would most likely be precipitated by. The options are phenytoin, which is an anti-epileptic drug, primaquine, it is an anti-malarial drug, isoniazid, an anti-tubercular drug, and pyridoxine hydrochloride, which is vitamin B6. So here the correct answer is option B, that is primaquine. Glucose 6-phosphate dehydrogenase is an enzyme found in the cytoplasm of all cells in the body. It is a housekeeping enzyme that plays a vital role in the prevention of cellular damage from reactive oxygen species. That is the main function of this G6PD is to protect the cells from reactive oxygen species. It does this by providing substrates to prevent oxidative damage. Erythrocytes are particularly vulnerable to reactive oxygen species due to their role in oxygen transport and inability to replace cellular proteins as mature cells. Glucose 6-phosphate dehydrogenase controls the initial step in the pentose phosphate pathway, bringing about the oxidation of glucose 6-phosphate to 6-phosphogluconate, which reduces NADP to NADPH. Many oxidant drugs, for example primaquine, sulfasoxazole probenecid, increase the rate of oxidation of glutathione. This increases the intracellular demand for NADPH to maintain glutathione in the reduced form. So in patients with a deficiency in erythrocyte G6PD, oxidized glutathione accumulates and by an unknown mechanism disrupts erythrocyte membrane integrity with subsequent hemolysis. In particular, anti-malarial agents have a strong association with inducing hemolytic anemia in patients with G6PD deficiency. So the drugs causing hemolytic anemia in G6PD deficiency include chloramphenicol, dapsone, sulfonamides, primaquine, quinidine, nitrofurantoin, probenecid and aspirin. Next question. The hematocrit, that is HCT, measures the options are total number of blood cells per volume of blood, weight of red blood cells per volume of blood, number of red blood cells per volume of blood, percentage of red blood cells per volume of blood. So here the correct answer is option D, that is hematocrit measures the percentage of red blood cells per volume of blood. So the whole blood treated with anticoagulant is centrifuged in a calibrated hematocrit tube. The volume ratio of the packed red blood cells to total blood volume is determined. The hematocrit is normally 39 to 49 for men and 33 to 43 for women. The hematocrit value provides some indication of both the number and size of the red blood cells present in an individual. Question number 74. Permethrin has been shown to be of clinical use in the management of. The options are venereal warts, scabies, acne, ringworm infections of the skin. So here the correct answer is option B, that is scabies. Permethrin is a drug of choice for scabies. Permethrin is a scabicide and pediculocide. It acts on the parasite's nerve cell membrane causing paralysis. It is only for external use. Next question. Zollinger-Ellison syndrome can be best treated with. The options are lithium products, proton pump inhibitors, cytoprotectants, HMG coenzyme reductase inhibitors. So here the correct answer is option B, that is proton pump inhibitors. So Zollinger-Ellison syndrome is a condition characterized by gastric acid hypersecretion and recurrent peptic ulceration. It is generally the result of a gastrin-producing tumor. The proton pump inhibitors such as omeprazole and lansoprazole are effective in managing the acid secretion in this condition. So with this question, we have completed today's recalls discussion. Thank you for watching this video. Have a good day. Let's see you in the upcoming session.